In this video, we are going to learn new HCC coding common interview Q&A. So previously, I have created one video related to common HCC coding interview questions and answers. This is the video related to HCC common interview questions and answers, latest or new updates. If you want to watch previous video, this is the video I am telling HCC common interview questions and answer. So it is having 10 minutes 57 seconds. So you can watch this video, few more common interview questions and answers. So now we will go to our original session. So if you go to interview, they may ask you list out any 10 critical conditions. Okay. So these are the common critical conditions: CBA, cerebrovascular accident; MI, myocardial infarction; AAA, aortic abdominal aortic aneurysm; PE, pulmonary embolism; fracture; 6 sinus syndrome; sepsis; deep vein thrombosis; cancer; HIV. So these are the critical conditions. Patient needs to take the physician attention as soon as possible in order to treat these conditions. So next one is list out any 10 acute conditions. So these are the critical conditions. Without treatment, these conditions will create life threatening. Okay. So must and should we need to take treatment for all these conditions. Okay. So that's why they have mentioned here it as critical. Next we are having list out any 10 acute conditions. Okay. So basically acute conditions are in sudden onset. So these are the common acute conditions. In the interview, if they ask you, tell me few acute conditions, so you can remember all these conditions: ARF, AKI, acute pancreatitis, acute liver failure, acute angle closure glaucoma, severe burns, GORD, small bowel obstruction, severe hypertensive emergency, and fracture. Okay. Next, we are having latest common interview question: list out any 10 chronic conditions. Okay. Most of the time these chronic conditions, irrespective of the coding specialty, we will use these chronic conditions like diabetes, hypertension, COPD, CHF, CKD, rheumatoid arthritis, multiple sclerosis, lupus, HIV, Crohn's disease, and pancytopenia. Okay. So next we are having pancytopenia. So what is pancytopenia? Involves having low levels of red blood cells, white blood cells, and platelets. Okay. So penia means low levels. Pan means all blood cells. So red blood cells, white blood cells, and platelets. Okay. So most common symptoms for these conditions is anemia, where you will have low blood red cells and increased risk of infection if you are having low white blood cells, and excessive bruising or bleeding if you are having low platelets. So based on the blood cells, we are having the conditions. So if anyone looking for pre-APC chapter webinar links for pre-CUs or medical coding jobs in India, USA, UAE, join in our WhatsApp group. So this is the group link which is in the description of this video. And also if anyone looking for same day surgery training, IPDRG training, SCC training, CCS training, please send WhatsApp message to 707-526-3939. So and also if you are a newcomer, if you want to learn free medical coding, so these are the playlist. You can use this playlist in order to learn medical coding. For example, if you want to go for interview as a HCC coder, so this is the playlist. Here you will get nearly 21 videos related to HCC coding. So next we are having what is monoplegia, hemiplegia, paraplegia, quadriplegia. So these are the common interview questions. So monoplegia, this refers to paralysis of one limb. Mono means single basically. It might be arm or leg. Hemiplegia, so this is paralysis affecting one entire side of the body. For example, left arm and left leg, or right arm or right leg. Okay. So sometimes this hemiplegia also includes face also. Okay, face on the one side only one side, whether it is left or right. Paraplegia. This is paralysis that affect the lower half of the body. Okay, including both legs and often the pelvic organs. Okay, so the arms and upper body are typically not affected during the paraplegia. Next is quadriplegia. So this is paralysis that affects all four limbs and usually the torso or trunk, where there is significant loss of movement and sensation below the neck. Okay. Next one is list out any 5 oral hypoglycemic drugs: metformin, glipizide, oglibos, glimepiride, bromocriptine, and Januvia. Okay, and sertralinas. So Januvia is a one type of hypoglycemic drug which most of the time we will use for diabetes control. What is ectomy? So this is simple. So ectomy means removal of specified part of the body. For example, if you see appendectomy, so removal of the appendix. Okay. So what is thrombocytopenia? So thrombocytopenia is a condition in which there is an abnormally low number of platelets. Other name for platelets is thrombocytes in the blood. So low number of thrombocytes is called as thrombocytopenia. So what is thromboembolism? Blockage of blood vessels due to moving blood clot. Okay. So next, what are types of joints? Fibrous joints, cartilaginous joint, and synovial joints. These are the common types of joints which we have inside our body. Okay. Next, what is remission and relapse of cancer? So remission means in partial remission, some but not all symptoms and signs of cancer have disappeared. In complete remission, all signs and symptoms of cancer have disappeared. There are no other cell detected or there is no evidence of disease or NED. Okay. In remission, we are having partial remission, complete remission. So partial remission, only few symptoms and signs disappeared, not complete. Okay. What is uncertain behavior of cancer? So the uncertain behavior of cancer refers to the unpredictable nature of how a neoplasm will develop and progress. Okay. So what is meant by carcinoma in situ? So most of the time you will see this diagnosis in the DCIS, ductal carcinoma in situ, is the earliest stage of cancer where abnormal cells are present but have not spread to surrounding tissues. It is considered a non-invasive stage and is often curable, particularly with surgical intervention. Okay. Carcinoma in situ, so which will not spread to other sides of the body or surrounding tissues. What is AV fistula? So another name for AV fistula is arteriovenous fistula, is when an artery and vein connect directly, allowing blood flow to incorrectly. Okay. Next, occlusion. So the act of closing, blocking or shutting something, or the state of being closed or blocked, is called as occlusion. Next, TIA or transient ischemic attack. The other name for TIA is mini stroke. Is a temporary disruption of blood flow to the brain, causing symptoms similar to a stroke but lasting only shorter time, typically less than 24 hours. Okay. So multiple sclerosis. Okay. So the autoimmune disorders of nervous system can attack the CNS, which include brain, spinal cord, or PNS. PNS means peripheral nervous system, consisting of nerves that connect to the CNS. Okay. Next, what are the fractures types? So we are having, there are two types of fractures: traumatic fractures and non-traumatic fractures. Most of the time traumatic fractures are acute conditions, most of the time which will occur due to injury or accidents. Non-traumatic fractures are most of the time due to bone conditions like osteoporosis, bone cancer, or any type of neoplasms. Okay. Next, traumatic, we are having, these are the types of traumatic fracture: closed, open, crepitus, colles, comminuted, green stick, and compression fracture. So in the operative report or in the interview, if they ask you what are the few examples for non-traumatic fracture, The reason for non-traumatic fractures is osteomyelitis, osteoporosis, osteogenic sarcoma. Okay. So what is meant by brackets and parentheses? So brackets means this is another way to say something, or here is the little extra info to help you understand. Okay. So what is parenthesis? These words might be there or not, and it does not change the main code you pick. Okay. So brackets most of the time we will use for synonyms, explanations, or how a condition shows up. Most of the time we will see parentheses for optional extra words that does not change the code. These are the difference between brackets and parentheses. Next is the differences between retrospective and prospective coding. So prospective coding means coding before the doctor sends the bill. Okay, it's like checking your shopping list before pay to make sure everything is right. The goal is to get it the right first time. So retrospective coding after the doctor sends the bill. It is like checking your receipt after you pay to see if there were any mistakes. Okay, the main purpose of retrospective coding is to fix any errors that already happened. Okay. So what is part A, part B, part C and part D? So part A is for most of the time hospital insurance. Most of the time we will use for inpatient care. Part B is for medical insurance. This part covers your outpatient care and many other medical services. Okay. Part C includes or bundles part A and part B. Part D, this part help cover the cost of prescription drugs. Okay. So next one is what is the difference between HCC and RxHCC? HCC predicts how much a person will cost for doctor visits and hospital stays. It helps Medicare pay health plans for sicker people. Okay. So next prescription HCC or RxHCC predicts how much a person will cost for medicine. It helps Medicare pay during drug plans for people who need more expensive drugs. Okay. Next, what is etiology manifestation? So this is simple. Etiology means cause of the condition. Okay. Manifestation means the sign or symptom of the disease or condition. Okay. So these are the most common interview questions nowadays you will encounter in HCC coding interviews. So if you are having any doubt or any type of confusion, please mention in the comment section of this video so that I can make one more video related to HCC coding topics. So once again, thanks for visiting our channel. If anyone looking for same day surgery coding training or free APC CU webinars or jobs in India, UAE, USA, please join in our WhatsApp group. And if you want to know more information about our training, please send WhatsApp messages to 707-526-3939.